100.
100.
The only constant in life is changes. Their hair will turn to grey, their eyes will grow dim, and they might even spill some tea. But those are not the reasons for us to neglect nor mistreat them, because we are all aging since the day we were born. Their present might be our future. We are the Yellow Jackets, proudly presenting Go Elderly. Grey is the new gold.
Untuk mencegah bahwa lansia itu menjadi beban bagi masyarakat, kita harus memberdayakan lansia itu, gitu. Karena lansia itu sebetulnya sangat potensial sekali. Mereka punya pengetahuan, punya pengalaman yang luar biasa, gitu, dalam usia mereka. Nah itu
The Asia Pacific is the fastest aging region in the world, when we will reach 200 million people above 65 years old by 2030, and 39 million of them are Indonesian. It is all inevitable that people live longer with higher life expectancy. But this implicates unproductivity, a higher prevalence of non-communicable diseases, increased national healthcare expenditure, and geriatric syndrome present in the society. No one will be left behind, as the essence of sustainable development 2030 visions will also involve the elderly in the process of attaining sustainable development. Healthy and active aging is the way. The WHO has published 10 indicators of age-friendly cities to be adopted by countries.
In response to population aging, there are two major factors that represent the greatest challenges, which are healthcare and social sector. First, in terms of healthcare, many countries are struggling to control the growth of the elderly population. This results in unevenness and even inadequacy in the services that they may receive. Screening or early detection and even long-term healthcare services are reduced significantly. Both of these can be caused by the low quality of the caregivers and even professional healthcare workers. Second, in regard to the social sector, unsupportive environment has been haunting the welfare of the elderly. The elderly are stigmatized as a burden to the society, weak and useless. They are neglected, lonely, in need of a community, and eager for social interaction.
As youth, it is our responsibility to be the agent of change, to try our best to create an age-friendly environment. Youth can initiate a platform to assist the family, community, and even the elderly to actively contribute in improving the elderly care and health services. Therefore, we present to you Go Elderly with our tagline, Grey is the new gold. This online platform aims to provide an inclusive society for the elderly by involving as many people as possible. We have two main objectives, which are to educate the families and caregivers, as well as increasing the awareness of the people about the importance of the elderly. In particular, we expect that this platform can increase the family's ability and capability to take care of their elder with such prevalent diseases such as dementia, stroke, diabetes, and many more.
Before logging in, you can choose the language in which we provide Indonesian, English, and Mandarin as the options. At the homepage section, you will find our latest events and updates about Go Elderly. We'll also connect the users, whether it's the elderly themselves or the family of elders, with the closest primary healthcare facilities so they can better access their health tracking. You can also continuously update with the inbox feature. At our community list, we'll provide lists of activities, location, and membership details to help you pick which one to join. Here are our courses and information. We'll focus on providing family-based care information. And lastly, we'll give you extra membership discount after you finish a certain number of resources. You can check at the profile section, that is reward feature, to help you keep on track. We have analyzed several possible challenges to launch and socialize this platform. First, it might be intimidating for the elders, the users, the healthcare providers, or even the community team to operate the technology. Secondly, it might be hard to ensure the smoothness of all operational stuff on our platform. And thirdly, it might be hard for the elderly that are having disability or negative experiences to join any communities.
However, as the only youth-led online platform that focuses on the elderly, especially in Indonesia, we believe that a gradual launch can help the Go Elderly team and the users to adapt better.
The last couple of months, we have created webinars, podcasts, and social media campaigns regarding elderly care and welfare. Ever since the COVID-19 pandemic, digital literacy has never been higher. Hence, we plan to hold those programs on a monthly basis. We believe this is an effective approach, especially on urban areas in which elderly mistreatment and abuse are more highly perceived. We also plan to integrate this technology with healthcare providers and elderly communities. Our platform aims to be inclusive to all elderly from various health and social backgrounds. This is where collaboration with our partners comes in. For example, we would like to connect elders with Alzheimer's to Alzheimer-focused organizations and so on to provide the support they need. To ensure the sustainability of this platform, we plan to connect with various partners, such as government institutions, local communities, and youth-empowered organizations. Furthermore, we plan on holding annual events to gather all of our users and the elderly supporting system, especially in the greater area of Jakarta, where our first pilot project was launched.
As we have started the campaign in the mid of May 2020, we have celebrated Indonesia's National Elderly Day on 29th May 2020 by hosting a webinar with hundreds of participants, reflecting the enthusiasm of both young generation and elderly in learning more about elderly care in Indonesia. The data that we have gathered will be used as the basis of our content. From our webinar survey, 73% responded that the main challenges of elderly living in Indonesia were decreased productivity, social interaction, and immune system. 84% of respondents stated that the best way to convey information to the elderly will be through articles and educational video delivered by the community in simpler words. 89% of respondents stated that the society needs to help the elderly to maintain a healthy and positive lifestyle by participating in the community and building a supportive environment. This is our weekly, monthly, and annual plan for the next 5 years. In 2020, we'll be conducting survey and we will launch our website. Well, our application will be launched in the following year, 2021. In 2022, we'll develop our platform and we'll collaborate with other organizations. In 2023, we'll focus on improving and maintaining our platform. In 2024, we'll be conducting evaluation for all the programs that we've conducted and developed for the past 4 years. Starting from July 2020, we'll be conducting survey to gather evidence and preferences. While from August to December 2020, we'll be building partnership with governmental and non-governmental organizations. We will officially launch our application in the first week of January 2021. Annually, every May, we'll be holding an annual elderly festival to simply gather and create intergenerational events. From February to April, we'll be conducting volunteer recruitment, while June to November will be allocated for roadshows across Indonesia. Every year in December, we'll be evaluating all our programs. To monitor and evaluate, we'll measure the impact of our platform quantitatively and qualitatively. We will conduct monthly monitoring on the traffic of our platform, including our social media, website, and application. For qualitative measures, we'll synchronize the indicators of our objectives, which are better understanding and knowledge of elderly care from user review, as well as higher participation in elderly community. On a larger scale, we will continuously develop indicators with public healthcare services and providers on the impact of our platform on elderly's health profile.
Our budgeting plans will be divided into two, which are early infestation and late infestation. Hereby, we provide you with our realistic and pessimistic financial allocations. In total, for a 5 years program, we'll spend $2 million for a realistic plan and $1.75 million for pessimistic.
As a multicultural region, we have and will always respect our elders. The phenomenon of the aging population might show that even the universe favors the elders. Thus, it is our turn to display our favorite movement.
Go elderly!
Elderly.
Together,
Together,
Great.
great.